So I will be showing the environment of where the physical assessment will be conducted. There's nothing on the floor, nothing on the ceiling. And here is where the camera will be placed. Right. All right, great. Okay. Hi, my name is Kriza, and I will be your nurse today. How are you doing?
I'm well, thank you.
Great. So today we are going to do a physical assessment from the head to the neck. I'll also be asking you some questions to put for your electronic health record. In addition, I will be inputting any data that's collected from this assessment. All collected information is kept confidential. Your privacy and safety is our priority. So before we begin, I'll go wash my hands. Do you have any questions or concerns before we begin?
Not at this time, no.
Okay. All right, so what is your name?
My name is Joseph.
Okay, and what is today's date?
Today is Saturday, October 10th.
And where are you now?
We are in my apartment in Weehawken, New Jersey.
All right, great. So patient appears to be alert and oriented. So now I am going to assess your vitals, starting with your pulse. All right. All right, I will be assessing your radial pulse for a moment. All right, I checked the patient's pulse for 30 seconds, then followed with checking respirations for 30 seconds. I didn't want to inform the patient that respirations were being counted, so he didn't alter his breathing. So your pulse is great. It is 84 beats per minute. Your respirations are 18 breaths per minute. These are great numbers and definitely within the healthy range. Now I will assess your blood pressure. All right. Okay, cuff is snug, it's not too tight, and is not too loose. All right, great. Your blood pressure is 110/70, which is within the healthy range. Okay, now I will assess your face. Have you had any facial swelling?
I have not.
Okay, great. Have you ever felt any pain in your face?
I have not.
Okay. And have you ever had any facial tics or involuntary movement?
No.
Okay, great. So let me see. I will inspect your face. Upon inspection of the face, I see symmetry of the facial structures and expression with no involuntary movement. I see no edemas or lesions. Please smile and please frown. All right, we just tested cranial nerve 7, which is the facial nerve. This is the nerve that is responsible for the movement of your facial muscles. Okay, great. So expected findings of the older adult would be more prominent bone features or more prominent facial bone features, along with sagging skin due to decreased elasticity and subcutaneous fat of the face. Okay, great. So now we are done assessing the face, and now I will begin to assess your eyes. All right. Do you have any difficulty with vision at all?
Yes, I'm wearing contacts.
Okay. And do you have any pain or swelling in your eyes?
I do not.
Okay, great. And are your eyes ever typically watery or teary?
No.
Okay, great. Okay, upon inspection of the eyes, the external ocular features of the eyebrows, eyelids, and eyelashes are symmetrical. I will be touching your face to further assess your eyes. Please look up. Okay, great. And please look down. Great. Conjunctiva is clear with no signs of redness, and there is a normal amount of blood vessels visible, and sclera is clear and white. Okay, great. Let's see what I need here. Let me just get some of my tools. Okay, so your irises appear round and equal. I will use the light to check your cornea. Okay, there is no cloudiness in the cornea or lens, and the corneal light reflex is symmetrical. I will proceed to assess the light reflex of your pupils. Remain looking straight ahead. Okay, great. Okay, great. Both eyes have direct and indirect constriction, indicating a healthy pupillary light reflex. Now we will test the accommodation of your pupils. Please keep your gaze on the object as it approaches you. Okay, great. Eyes equally converge and constrict in relation of the object. Okay, now I will test your extraocular eye muscles. Follow my finger. Right, great. There is parallel tracking of the eyes with no indication of ocular muscle weakness. Pupils are equal, round, and reactive to light and accommodation, which is great. So now we will test your vision. You can stand up, please. So 20 feet over there, there is a Snellen chart. Here is a blank index card. If you could please cover one eye. Okay, perfect. Read the lowest line that you can.
STRAW.
All right, perfect. Try the line below.
PATCH.
All right, great. So left eye is 20/20 with the use of contacts. Now please switch to the other eye. What is the lowest line you can read?
STRAW.
Great. What is the line before that? You can give it a shot.
Patch.
Great. So right eye is 20/20 with use of contacts. Both eyes have 20/20 vision. This means at a distance of 20 feet, you are able to see clearly what a healthy person with perfect vision will be able to see at the distance of 20 feet. This also indicates that your cranial nerve 2 is perfectly intact. Now I will use my ophthalmoscope to inspect your inner ocular structures. All right, I see the retina, which appears orange with visible vascular structures in all quadrants. Macula is present. Physiological cup and optic discs is bright and yellow white. Cup disc ratio is normal in diameter. Now we move to the next eye. Right eye has some identical and symmetrical internal ocular findings as the left eye. Optic discs have a sharp border and are clear, and there are no signs of venous disformities. All right, great. So patient has perfect 20/20 vision with the use of contacts and no physiological abnormalities. The expected findings in the older adult is potential presbyopia and cloudiness of the cornea. Both of these occur with aging. So now we are moving along to the nose. Do you get any nosebleeds?
I do not.
All right, great. Have you ever had any changes in smell?
No.
Great. And have you ever felt any pain or discomfort in your sinuses?
I have not.
Okay, great. So upon inspection, nose is symmetric along a midline and proportionate to facial features. There are no deformities, inflammation, or skin lesions that are visible. So let's test the patency of your nostrils. Press down on one nostril and inhale briefly with the nostril that is open. Great. So now do it with the other one. Perfect. Nostrils are patent with no signs of any obstructions. So now I want you to take a sniff of this. Do you smell anything?
Yes, it smells like cinnamon.
Great. So we just tested your olfactory nerve, which is cranial nerve 1. This nerve is responsible for your sense and function of smell. Okay, so now I will grab my otoscope, and I will be using the otoscope to inspect the internal structures of your nose. If you could please tilt your head up. Okay, great. Nasal septum has no signs of deviation or perforation. Nasal mucosa is normal red color and smooth with a moist surface. Awesome. I will now check the other nose. This nair shows symmetrical mucosal findings, and septum structure is the same with no deviation or perforation. Both internal nairs have normal cilia and no signs of infection. So also the nair showed symmetrical light illumination. I will further assess by touching your face to palpate your sinuses. All right. Did it along the eyebrows. Now moving along to below the cheeks. Great. So there is no indication of tenderness or infection of the sinuses. Great. So expected findings of the older adult is an increased appearance of nose hair and decreased sense of smell from a decreasing number of olfactory nerve fibers. All right. So we just finished assessing your nose. So now I will begin to assess your mouth and throat. Okay, let me see. So upon inspection, everything seems symmetrical. But first off, before you continue, do you have any difficulty swallowing?
I do not.
Okay, great. Do you have any pain in your mouth or throat?
I do not.
Okay. And how's your dental care?
Pretty good, thank you.
You're welcome. Great. So upon inspection, your mouth, like I said previously, your mouth and lips appear symmetrical and proportionate. Now please stick out your tongue. You don't have to say ah, but stick it out wide and move it side to side. Perfect. Great. We just tested your hypoglossal nerve, which is cranial nerve 12. This nerve is responsible for the function of the movement of your tongue. Okay, great. Please open your mouth and I will use my pen light. Mucosa membranes appear healthy and pink with no signs of lesions, nodules, or abnormalities. Lips and tongue are healthy in color with no indications of sores or lesions. Teeth are white and with no signs of decay, and gums are pink with no signs of swelling or bleeding. Please lift the roof of your tongue. Great. Ventral surface of tongue is vascular, smooth, and saliva is present. You can lower your tongue. Wharton and Stenson ducts are intact and are along the second molar. Now please say ah.
Ah.
If you could please lower your mouth and lower your neck.
Ah.
Okay, great. Uvula appears normal and rises along the midline. Oropharynx appears healthy as it is vascular and reddish pink with no indications of infection. Tonsils appear healthy with no signs of swelling or discoloration or infection, and your tonsils have a grade of +1 in size. All right, great. So expected adult findings of the mouth and throat consist of receding gums and decreased saliva production. Both of these occur with aging. All right, great. So we are done assessing the mouth and throat, and now we will proceed to assess the neck. Do you feel any stiffness in your neck?
I don't.
Okay, great. Do you ever feel any swelling or pain in your neck?
I do not.
Okay. What about any pain around your neck?
No pain.
All right. So far, so good. Okay, let me inspect you. Upon inspection, head is centered along the midline and erect. Accessory neck muscles appear symmetrical. All right, please bring your chin to your chest. Perfect. Now extend your head up and turn your head side to side and tilt your head back and forth. Perfect. Patient has full range of motion in the neck with no indication of swelling of the salivary or lymph glands. Okay, trachea appears centered along the midline and neck appears symmetrical and proportionate. Now I will touch your neck to palpate your lymph nodes. Please let me know if you feel any discomfort or pain. All right, here is the preauricular, moving back towards the posterior auricular. All right, back here are the occipitals, moving forward towards the jawline. Here is your jugulogastric. Right here is the submandibular. And over here under the beard, right here, are your submental nodes. I will now be moving back here. Here are your superficial cervical nodes. I am moving along the deep cervical chain to the posterior cervical. And lastly, I am palpating the supraclavicular nodes. Perfect. Nodes are non-tender, discrete, movable, and normal in size. Great. So expected adult findings is decreased palpability of cervical nodes and decreased range of motion in the neck. All right, so now we are done assessing your neck, and now we have one more thing, and it is the ears. Have you experienced any pain in the ears?
No.
So no earaches?
No.
Have you experienced any loss of hearing recently?
I have not, no.
All right, great. Have you ever had any ear infections?
No, I have not.
Awesome. So let me inspect. Ears appear symmetrical with no signs of discoloration or swelling. Okay, let me get one more thing. I will now inspect your ear by using an otoscope. Okay, great. There are no signs of swelling, lesions. Let me check this ear as well. Discoloration or abnormalities in the external ear canal. Now I'm going to inspect your inner ear. I'll be pulling your pinna back and up. Please let me know if you feel any discomfort or pain. All right. I can see the eardrum. It is pearly white, it is pearly gray in color and shiny. I see the otoscope light reflection in a 7 o'clock position, and tympanic membrane is intact. Great. So let me assess this ear, and I will be doing the same process. All right. So otoscope light reflection is in the 5 o'clock position. Eardrums are pearly gray in color and shiny, and tympanic membrane is intact. Great. So now I will assess your hearing. Before I use my tuning fork, we will be doing the whisper test. I'll place one of your fingers on your tragus, like so. All right, great. And then you will be repeating the random sequence of numbers or letters that I will say. We will start with the left ear, so please press on your right ear.
Okay.
All right.
5 and 7.
Oh, sorry. Please switch to the other.
GT8.
Great. So far you have no indication of hearing loss. So now we will test the air conduction and the bone conduction of your ears. I will be using a tuning fork. First, I will be doing the Weber test, and I will be placing the tuning fork on top of your head. Let me know whether you can hear the sound equally in both ears.
I can hear the sound in both ears equally.
Okay, so one is not louder than the other?
No.
Great. So now we will do the Renee test, and I will now place the tuning fork next to your ear for the first sound, and then I will put it on top of your ear for the second sound. Let me know which sound is longer. So first I will do the left ear.
The first one was longer, the one that was next to the ear.
Perfect. And I will do it again with this ear.
It was the first one again that was to the side of the ear.
All right, perfect. Ears have lateral hearing, and air conduction is greater than bone conduction, which indicates normal and healthy function of hearing. Patient's ears appear healthy and clean with no indications of hearing loss or obstructions. Great. Awesome. So expected findings in the older adult could be presbycusis, and the cilia lining of the ear canal could appear coarse and stiff. Great, so we finished your physical health assessment of the head and neck region. I have inspected your face, your eyes, your nose, your mouth, your throat, your neck, and your ears. And everything seems great. Nothing raises any further concerns. And I think you are all set. I will document all findings from this assessment in your electronic health record, which only you and your providers have access to when needed. Okay, now that we are done, I will wash my hands. Do you have any further questions or concerns about anything we discussed today?
I do not know.
All right, perfect. Okay, so you are free to go, and you are all set, and it was a pleasure meeting you.
Thanks so much. It was a pleasure meeting you as well.